Test, test, check, check.
Check, check.
We've got another theater major with us, so
Oh,
she's
my.
totally fine on.
You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast.
Hey, everybody, welcome back to another episode of the NeuroRESET podcast. I'm Dr. Teams, and we are here with Abigail's mother. So what this podcast is going to be like is really kind of working through her daughter's case from a parent's point of view. But also, if we have time, we'll cover what your experience was like as a parent or as a patient. Can you go let her in? She's locked out. Headset. So, okay. So what do you want to start with? What was the experience like watching what happened from like a fully functioning daughter to basically a non-functioning daughter?
Yes, that is a long story that I will try and encapsulate a little bit, but it'll be 4 years since the day that she locked up with TMJ. Mm-hmm. But that was just the trigger for something that we now know is much deeper than that. But that began the highest intensity of crazy for us.
Yeah.
Because it set into motion the scramble and desperate, months and months and months of trying to figure out what in the world was wrong and getting nowhere. I was talking to Abby. I kind of forget, and I know that's healthy amnesia, my self-protection.
For sure.
But talking about it and watching her podcast with you, it has triggered some thinking that is hard, but good.
But it's like part of the healing process,
it is,
right?
It is, and she even asked me on the way, "Is it making you stressed to talk about it?" And I said, "It's not. It's not stress. It's just." It's taking me back to a place and honestly remembering and reminding me of how far we've come and a gratefulness in that, man, we made it through that. Yeah. And so,
because when you're in it so long, it's hard to see the light at the end of the tunnel.
Oh, completely.
And, the like we were talking about with Abigail, it's like, your behavior that you've developed in the box, I call it, or in the pit of misery, you have to change it in order to get out of the pit of misery, right? Mm-hmm. Sometimes it happens passively, like as Abigail got better, it would help you a little bit, but you were still in that same, you're like, I got to put out fires, but there were way less fires to put out, mm-hmm. right? And so that's where we transitioned from just being the mom caretaker to becoming the patient so you can have your healing too.
Exactly.
So, my question is more so, what was the process kind of from that initial traumatic event from her freshman year in college, mm-hmm. kind of through the recommendations of jaw surgery to everything that like didn't seem to work? Like, I guess, where did you find that there were other resources available? Like, how long did it take you?
Yeah, good question. So, the events her freshman year in college were pretty severe, and that is the beginning of realizing that there was a bigger monster going on here.
Yeah.
And then what I believe in hindsight 100% is she had some debilitating vestibular migraines, is what we were told, for about 2.5 years during that college situation. And she would drop to the ground and I'd be carrying her and bedridden, go get a cocktail at the ER, sleep it off for 2 days, and I'd have her back. When she came out of surgery for TMJ, I knew that she was back right there. And I didn't know why, because she had been better for about 2 years. I think maybe more than that. 4 years. I'm sorry.
When you say better, were you functionally better?
Functionally better, like, yeah, okay. She was at college. Yeah. She was independent, struggling, but functional and able to finish college with high honors and fighting for everything.
Yeah.
But it was hard. It was hard times.
And it
but
was like invisible to the naked eye. To
yes,
every one of us, we would have seen Abigail just going through, getting grades, honors, but
right,
you feel the opposite, right? Yeah.
right,
Yeah.
exactly. So when COVID hit, and she was a COVID college non-graduate, no graduation, and the jaw literally locked up the day we were going to pretend to have her graduation. And
Whoa,
so
I didn't
I
know
I
that.
had planned a party. I had balloons. I know I had a whole plan. So anyway, she comes out of that, and that's when I knew something is wrong, like really wrong. But we were, let me back up just a little bit. In the middle of all of this, my husband unfortunately went through 4 jobs in 4 years. That changes your health insurance 4 times in 4 years. That changes what doctors you can see. We got an MRI with one doctor for Abby, and within a week, I couldn't go to the doctor to get it read without paying them a ton of money because our insurance didn't work for him. So there was all this extra chaos that was affecting the decisions for her. So we end up back on, we get on insurance, and that answer is to go maxillofacial surgery and fix this from a surgical point of view. And at that point, I had a girl in a dark room on Oxy for too long, 3 weeks.
On what?
Oxy.
Yeah.
Yeah, for 3 weeks. And I was like, I have to do something. Nothing
This is
about
after the
this.
surgery.
This is before. This is
Before
when
the
she's
surgery.
lockjawed.
Gotcha.
And she couldn't walk. She couldn't eat. I mean, I was force feeding liquids because she couldn't open her mouth very far. So she has that surgery and comes out, but I knew something had triggered. I knew something was wrong, and I saw the level of pain in an outpatient thing that she was supposed to go home, and we were there until 9 p.m. and they finally admitted her because they finally believed me. I said, I can't even get her to the car. And she was supposed to be in a little chair recovering. This is what everybody else does, and walk out. Outpatient surgery, one day, one morning gone. And we're there at 9 p.m. and she can't uncover her head still. I still have a blanket over her head feeding her ice chips. And something was wrong beyond the TMJ. Like I knew. I guess that's a mom thing, but I knew. So that began this world of going what they would send us to and specialists, and for about a month. And I went in my kitchen one day and there's 17 bottles of pills, 4 of them with red tape on it, which is a controlled substance that I didn't want her on. And I said, I can't do this to my daughter. At the time, she's 21. I'm going to get emotional. That was just I can't do this. This cannot be the only way. And with all of that, she wasn't any better. That was the hardest thing. And this was a couple months after. So that's when I said, I don't know what I have to do, but I literally, I'm a very, I don't have a lot of knowledge in this whole world that we have now. I do, but we were just thrust into it. But I was just a mama bear, too angry at what I was being told to stay there. She has a lot of my stubbornness and drive.
Yes,
and
sure.
and it's just when I believe something, like I'm not gonna sit there and not fight for it. So I started doing my own research, but thankfully from my childhood, from my parents, I had gone to chiropractic care from bad accident for years, and it changed my life. My dad was told he wasn't going to walk again, and because of chiropractic care, walked for the rest of his life.
Awesome.
So I wasn't afraid of off the beaten path care. And so I was already involved with a chiropractor with my other daughter, another daughter you treated. And I just started going to him. And then I had also kind of a non-traditional doctor that was a muscle specialist that also thought about things differently. And she started sending me to different people. And then we find out that we lost another job, and we find a job, and in 2 weeks we're moving across the country from Virginia to Arizona, right in the middle. We didn't even know how to get Abigail here. We had to ask other dear friends of mine to keep her with them and make sure that she ate and survived until we could fly her here.
So you guys all moved out here and you stayed back in Virginia?
because I knew she couldn't make the drive. There was no way. There was no way. It was going to be a miracle that she made the airplane flight. And it was thanks to a sweet couple on the airplane. It was an angel in disguise, in my opinion, that literally was my age and reminded Abby of me. And she happened to sit by Abby on the plane and literally doctored her across the country, nonstop flight, because I knew we couldn't do a change.
Sure.
So she got here, beat me, because I was coming in another car with my mother, and beat her dad, got her, and, you know, straight to the apartment and in a dark room just to try and figure out what to do next. So we didn't know why we were coming to Arizona. We never lived anywhere near here, even though we lived all over the world. And then all of a sudden, I'm desperate for help, and I end up at Dr. Lavender's office, which you've promoted him. And so we go see him rather quickly, because that's where I knew to start, was chiropractic. I didn't know what else to do, but I knew they could help me. So we go to Dr. Lavender, and that started this. And I will attribute, we did have a neurologist in a traditional hospital system here, and she did think out of the box for the first time, and she was validating everything that we were saying that no one else had, and that led me to say, okay, like, it was finally someone that it gave us a little bit of, like, you're not going crazy. There is, like, maybe we need to think about this. I would do research and find HEDS and stuff like that. And she'd go, oh yeah, that's probably what they have. But
Could you explain what that is?
It's Ehlers-Danlos syndrome with hypermobility. So they put the H at the beginning. And
So the common thing that people are going to hear is EDS, so
Yes.
Ehlers-Danlos syndrome.
Yes.
The H just indicates the hypermobility,
which is the
aspect of
most
that. Yeah.
common and the least, what do you call it? The least damage.
Invasive or
Yes.
severe, I guess
Yes,
you could say.
yes,
So-
it's the mildest version.
So ultimately, like, Ehlers-Danlos has a bunch of different, call them characteristics
Yeah.
or types. The most common one tends to be associate with, like, your vessels, the cardiovascular system. So it's just a little more lax than other systems. So it might pool more. It might not be as efficient squeezing and getting blood flow to go all over the place. And that's very common. It's generally a connective tissue type of disorder.
Yes.
People have it all the time. When you have EDS, you're much more prone to having things like POTS
Yes.
presentation.
Yes.
So
Yes.
that's what she's describing. So
Yes.
I didn't realize the H was going in front of that.
Yes.
So now, yeah, EDS, but in her
But
case,
with hypermobility.
So
Yeah.
HEDS.
Yes.
Sorry to interrupt there.
No, that's
so your
important.
neurologist is saying that they're totally on board. They're like,
Mm-hmm.
here's what's going on, and I totally believe you, right? Okay.
And both my girls, yes, both of my girls were sent to what and this is a year ago. So I'm not saying this is accurate for right now, but the only test for POTS is called a tilt table test. And both of my girls failed. They did not meet the criteria, but I couldn't take them home after the tilt table test. Both of them were on the ground and laying down for over an hour.
So so you're telling me that they failing the test, meaning
Oh, they didn't have it.
they didn't have.
They
Okay,
would say
so
they didn't have POTS.
So POTS is postural orthostatic tachycardia syndrome. So basically, when you stand up, your heart rate just goes crazy, right? The diagnostic criteria from 12 to 19 years old is a 40 beat per minute increase from laying down to tilting up. Technically, it's a 70-degree tilt. And with adults, so over 20, it's a 30 beat per minute change. So they were underneath that, but probably very close.
Yes.
And so you're in this gray area of you don't have a diagnosis. We don't know what's wrong, but it's all the exact same symptoms of POTS.
Exactly.
So that's where the term dysautonomia comes in.
Yes.
Right. So
Yep.
it's kind of like fibromyalgia and chronic pain.
Yes,
It's all
we
the
got
same.
all those words.
It's all the same
All the
stuff,
same
right?
thing.
And so it's just it's a term for, it checks these boxes, one less box, and it's not that. But
Right.
even though it is.
Right.
It's a
Right.
version of that.
Right.
Or an intensity of that.
Right.
So and so this tilt table test, you can actually do this at home. We do one in the office. It's a modified tilt table test. So 10 minutes laying down, measure your heart rate, stand up, measure your heart rate, and just basically you're looking for the most difference in between.
Exactly.
And so if you're testing positive, you'll be above the 30 beats a minute as an adult, above 40 as a child.
Mm-hmm.
And if you're negative, it's below that. It still doesn't mean that you don't have this process. It's just not severe enough to show up with a pulse.
Mm-hmm.
And so that's like our bread and butter is the POTS and the dysautonomia stuff.
Mm-hmm.
So sorry, keep going.
No, that's really important. And you know all the specifics that I've
All
already
the things.
forgotten.
Yeah, all the things. That's okay. We don't
don't
even
like-
need you. You can forget about
I
them.
can forget about all
yeah,
that
you
because
can
I
forget
have.
about them.
So that is just like, it has been, well, and I have to say, when we came to Arizona, we found out, I don't even know how we found out about Dr. Garza. And I will say his name. I hope that's okay. Dr. Garza from Dr. Lavender. See?
Yep.
He did give us everybody's name. So we end up at this renowned TMJ specialist, and that also was why we came to Arizona.
Cool.
So, he worked with both of my girls that did get diagnosed with TMJ, and so that I was told by somebody very wise that you're going to fight and you're going to find a team for your kid. Like, because she looked at Abby, it was a kind of naturopath in Virginia. And she said, you're going to need to find a team of people because this is complicated. And that's kind of what I did. And that's why if I didn't like what I heard at that one, we didn't go back, and we go to the next one. And it required, my boss at the time used to tell me, it's a good thing I know you're honest and you've worked for me a while, because I would never believe this, because I was calling out to take Abby to an appointment almost every day of the week. We would maybe have one day off. Wow. And multiple days, it would be two, one in the morning, one in the afternoon. And it was brutal, because
just
every
to try
time,
to figure out
just
what was
to
going
try and
on.
figure out what's going on.
Jeez.
And most of the time, Abby's in the car, like she came into your office. And so it was like getting somewhere an hour early and trying to make sure I can even get her in. We had to get a wheelchair because I was wheeling her almost to everything. We have a day when she didn't use the wheelchair. That's a very special day. And I took pictures of her walking in the field to a tree at the Walter Reed Army Medical Center, because it was such an incredible day. Mm-hmm. So it's not encouraging to people to tell them this part, but the brutal honesty is that it required something of me. And I had to work with my boss, work with my job, but I wasn't going to not fight for her. And it did cost us, but I don't regret it. Yeah. And it led us to finding that team that she told me I would. And that's you guys here. And that's what's brought her and Julia and then Ruthie on top of it to healing, and me. So it's, but it took 3.5 years and 3 years to get to youth. You know, we're almost at 4 now. Yeah. And I know people that have been 10 years trying to figure it out.
I talked with somebody 2 days ago who's been dealing with issues for 30 years. Mm-hmm. All of the same, like, dysautonomia stuff. Yeah. And I'm like, let's go.
I know.
Why are we wasting time?
I know. And don't you know that we didn't know all this? So 20 years ago, there wasn't much. But
nobody knew what to do.
Nobody knew what to do. And even now,
very few.
We were talking about it earlier. Still, POTS is very, very under known. I don't know what you say, not known,
underserved,
not understood,
for sure.
And yet it's coming out everywhere. Yeah. So
and like, we're talking with cardiologist after cardiologist. It's like, hey, do you guys work with this? They're like, no, we don't. Mm-hmm. So there's very few select cardiologists that know what it is and that can work with it.
Yes.
Same with neurologists. They might know what it is, but the treatment parameters seem to always be the same.
Yes.
It's going to be a beta blocker, usually. Increase your salt intake, whether it's salt water or whatever, salt tablets in some cases, and then compression stockings. Those are the three, and then graduated exercise. But when you can't even stand up, it's going to be almost impossible to do recumbent bike stuff.
Exactly.
Right? And so there's processes that you've got to work through. Mm-hmm. And one is understanding if psychology is involved. Most of the time it is.
It is.
Understanding if genetics are involved, which EDS is genetic. And so you look at the prognosis based on some of this information, and then we've got to be able to push and rehab the system and strengthen it at a level and a rate that's not going to crush her.
Exactly.
Right? And same thing with you. You pretty much handled everything we gave you, because you developed the grit, I guess you could say, being like, I'm the last person, like I'm the last person to push this crew. I can't break. But you were like holding on by a thread.
I was.
And that's what happens to caretakers. Mm-hmm. And caretakers break down invisibly.
Absolutely.
Because you can't, like, because everybody else is suffering, you can't, like, downplay their stuff to make yours important.
Right.
And you just bottle it up and you keep it in, and it just eats you alive.
Yeah.
And so, I think you even said it first. You're like, oh, you'll be dealing with me soon. Yes. Right. And that was our joke. We were always threatening. And then we finally got the opportunity to do this. Yeah. And And that was really awesome. I mean, we actually had a pretty quick turnaround with you too,
Oh yeah.
fairly quickly. And so
Well, because my brain was healthy, and you said that's probably why
you were able to
I
keep
was
it
able
together.
to do
Yeah.
as well as I did,
Yep.
and that's nothing I could have chosen. It just was a blessing. So,
Yep.
but I will. Can I say one thing?
Go for it.
And I did write a review, but I talk about a runaway horse.
That was
because-
amazing,
Okay,
by
this
the way.
this picture came to me pretty soon after me starting to do my sessions with you, but I just, we're out west. We love the cowboy life. I'm all into it. My daddy's a Texan.
Yeah.
I love my cowboy boots. Okay. So I just had this picture of that iconic scene that's always somebody's, the flailing victim on this horse that's taken off, and the cowboy comes in next to them. They don't get on the horse. They just come in next to them, and they grab the reins of the horse, and they slow the other horse down. And because I still had to be on the horse. I still had to do what I had to do. It wasn't fixing it for me, but it was coming alongside me. And I think and the other thing about that picture is that in my head, all of my kids are on the back, like hanging over, like they'd bring in the person that got hurt in the old Western,
Like
and
draped
they're
over the
draped
sides,
over the
yep.
side. So if I go down, they're all going down. I mean, this is the picture in my head. So I had to keep riding, even though it was out of control. I had to stay on, because if I fell off, they were all going to fall off, and who knows end up where. So that's the feeling of just completely out of control. And yet you're in control. You're not going to let anything happen to them.
Yeah.
So
Like you'll take the bullet, so to speak,
Right.
and just keep going.
Right.
And thank God you did.
Yeah.
It's
a good thing.
It's
And I am, it just took that, like that was huge, but I think it was so fast because first of all, I was ready and desperately ready, but also just, I had to see and be aware of how bad I had gotten. And that's another thing. I think when you're caregiving, you are just last. Self-care is last. And you are not even aware of where your brain has gone.
or just overall health.
Yeah.
Yeah.
I
And-
couldn't look at you like this when
Yeah.
I first came in. Do you remember that? You did the test and made me look at you in the eyes, and I couldn't do it. I don't even know what that was still.
Yeah.
But that's how it felt.
Yeah. It's not because I'm like really bad looking or mean or resting
It had nothing
type
to
of
do with
face.
how handsome he is
It
or
was,
not.
it's simply, I don't know the answer to that, but I do know that you weren't in a place to like maybe make another like connection with someone because you were so worried about your own that
Oh,
like
sure.
everything outside of like the length of your arms was like none of your concern because your bubble inside your bubble was all these kids that you were just fighting tooth and nail for. And I'm just glad that you did. I'm glad that you guys basically did everything you could, and here we are.
Yeah.
And so it's been such a pleasure, really, to be able to work with you guys and just see the beginning, the middle, and know that the end is in sight. Like we see light at the end of the tunnel.
Yes,
and we hear the
yes.
music now. We're that
Yes.
close. So, and first thing I said to you when you walked in is like, "Holy cow, you look great!" And
A little better than
that's
a year ago.
the tail end of, I think, all the work, some of the work that we did. So we
Yes.
worked on the nerve system. We calmed the system down. We had similar exercises or the same ones, just at different times, right? So it's
Yes.
customized based on what you go through. And then the last thing we did was we started actually running some functional testing, right? Some digestive type testing.
Yes.
And in fact, we have stuff now that's even better
Really?
that creates custom probiotics. So like we're all getting ready to do that as a staff,
Oh,
not
cool.
like separately, but
Yeah.
do our own program. And but like obviously that had a good impact because like
Yes.
you seriously look great.
Thank you. But I did change my diet in November when you got the results back, and it's been hard, but it's worth it.
Yeah.
It's worth it to feel better. Everything is worth it.
Yeah,
to feel
everything
better.
that's worth it
Yeah.
is not easy.
Yeah. It's
Right.
hard work.
Yeah.
And so that's and I know that when I first came in, well, until I started actually, it's also a out of body kind of like I couldn't stop moving. I was very
Do you remember
hyper
that?
reactive. Yeah.
Uh-huh.
I couldn't. I mean, I knew it. I would not lie about it.
So one of her exercises was to sit still for 10 seconds.
Not going to happen back then.
Didn't happen. Couldn't happen. It took like weeks to be able
Oh.
to do that.
Yeah.
Meanwhile, I should probably listen to my own advice as I'm like fidgeting over here, right?
Well, you've been sitting here a long time.
So, so what else? What's thank you for sharing your experience. I'm sure we could talk for a
Oh, I know.
long time about this.
Too
We can do
much.
another one if you ever want. But for what it's worth, like you can go check out the review that she left last week. That was incredible. It brought like most of our staff to tears.
I didn't mean to do
And
that, but it's just truth.
Again, we're just grateful that we have the opportunity to work with you guys. And we spent the last year together off and on with the whole family. I finally met Kevin at the open house, and that, it's just so cool to see the end-ish result of all the hard work you guys put in.
Absolutely.
And
But we're so grateful for y'all.
So
It felt like
the y'all, there's the Texan
I'm
right
sorry.
there. That's okay. My folks are from Texas, so I'll say y'all, and I can say
Yeah.
gooder and stuff like
I
that, because it's a
know. I got-
Texas thing.
when we came in, we haven't, she's been here, but I haven't been here for a little bit.
Mm-hmm.
So it was like seeing your old best favorite cousin,
Yeah. Yeah.
I just love that you have created that with your team, and it's a really special environment.
Well, thank you.
Um,
Yeah,
and I think-
these guys make it. It's
Yeah.
we couldn't do the things here without the team that we have around us. So
Takes a team. Absolutely. So we're so grateful. I mean, our lives are, it is not, it's not over. I don't know how to, we're still fighting.
I think I like to look at it as like life is a journey.
You're right.
And this is just a time frame
Right.
where we're dealing with certain things. It's like
Yes.
next month we're not going to be dealing with the same stuff, right? Like
Exactly.
it changes every month.
Right.
And there's going to be good days and bad days for all of us. Like
Exactly.
Monday, honestly, Monday was a terrible day for me for whatever reason. I
Sorry.
couldn't tell you why.
Okay.
It just was. And Tuesday was better. Today's way better.
Good.
And the rest of my day today is going to be amazing because you guys just reminded me.
Yeah. Why you're
of-
doing what you're doing.
Yeah. So like I get caught up in some of the negative stuff sometimes, and
Yeah.
situations like this, and just hearing this makes it all worth it. So
But I do think that it's really, really important. I know when you're dealing with your life shutting down and everything revolving around a sick child, some people don't get to have healing because they really are in a situation where it's going to be this way. But when there is something that can change and something that can come in and give healing, and it's not all fixed, but like you said, it's the journey of life. And it certainly is better, and we can face the next thing better,
Yeah.
and so much better. And I just can't emphasize the important. I mean, it only took me 8 sessions. I think I only did 8.
it wasn't very many.
wasn't
It
very
was
long.
quick with you.
And that's nothing for what it gave me and how it transformed my ability to actually let go, because that's a whole nother probably podcast, but about you become so connected to the child that you're trying to keep alive, and you just lose yourself in this identity of this role. And then all of a sudden they start to get better and you start to flail. And there's a real whole other, that.
And you know what? I don't know if you realize this, but it was totally by design. I think it was in the springtime, getting into the summer. I asked, when's the last time you guys went on a date night? This is long before you ever became a patient, but this was, for me, it was part of the healing process.
Mm-hmm.
And so like we were working together before we ever officially started working together.
Definitely.
But yeah, sending you guys on a date night was
did.
huge.
Lots of date nights because you were very generous.
And so that piece is super important. But like you said, you're so caught up in the mix of it, you didn't even realize what I was doing.
No.
But that was like as a thank you for trusting us with your entire family. But also like, hey, you guys go celebrate. You're working really hard and it's paying off. So thanks.
Thank you.
That's just a thank you.
It's just a big thank you.
Yeah.
Yeah.
So what's something kind of to wrap up our, call it part 1.
Mm-hmm.
What's something that you would share with maybe parents that are listening that are dealing with stuff with kids that are having a really difficult time in terms of this nervous system? What would you tell them?
Oh, that's hard. It really is, because I know
Are they alone?
No, definitely not alone. And I think that was also, you are so drowning in what you're in. It's hard to see, but you are definitely not alone. You definitely, especially if you come here, you're going to get some real help and hope. Like from the minute you walk in, I can't, there's no words to express that. But I think the biggest thing is that that you're not alone, and that to not to give up. That was terrible.
That's okay.
But
For theater major, I expected more. No, I'm kidding.
so
I'm
sorry.
joking. But yeah, I mean,
yes.
you can't quit.
Just don't quit. And even if you can just, like I just keep saying to people that we're trying to promote you everywhere, I'm just like, just give them a call. Like, just give them a call. Like, the call is free.
It all starts
It
with a
doesn't
phone call.
require anything but just that few minutes. Just give it a call. And then allow them to tell you, you know, what you need. Because I can't tell you that. Right. Every situation is different and unique. But, and then I think, there's just so many things. But I think to know, for not even just for your child, but again, that there's hope for you, and that you, I would say just talk to y'all. But if you can get to the point where you can look at yourself and take time to look at yourself, or think about where you're really at. And I don't know, that's really hard to do when you're in the middle of it. There's you're just going day to day. But if you can just identify, like, if you can never make it in here, just please take care of yourself. Like, just do something.
You know,
go on a walk,
listen to
breathe.
some of our podcasts, listen to
yes.
some of the techniques we've
Yes.
talked about, listen to some of the supplementation we've talked about.
Yes.
It doesn't, you know, it all works. There's a time and a place for each piece of it.
Right.
You know, if you're in the middle of a fight, right, taking care of a kiddo, it's going to be hard to truly get better until that person gets better, right?
Right.
So I had to do this with somebody else recently. I'm like, you know what? Your kid isn't sleeping. It's keeping you up every night. You can't heal because sleep is where we heal.
Yeah.
Let me work on your kid first.
Yeah.
And then we'll come back to you.
Right.
And so they're like, that sounds like a perfect idea.
Yes.
Okay, cool. Let's go.
Which is how it unfolded for me.
Yep. You
I
were
know
like,
you
we're going to wait.
wanted
I wanted
me,
to, but
I
you
was
were
like,
no
I can't.
place.
I know I won't do
Yeah.
it right. I just need to get her better so that I get my life back and my mind back.
Yep.
So it makes sense.
So now we got 3 daughters
Yeah.
that we pretty much don't have to worry about
Yeah.
unless they go up in the plane with the sun.
Then
And, you know, it's just been so awesome to be able to share this entire experience. I feel like we're a part of your, you know, family. At least you're part of ours,
are.
you know, and the gift that you guys gave us is super cool. We can't keep it on the wall. For some reason, the little attachment keeps coming off, but we'll
no.
fix it.
I'm sorry.
And yeah, one day we walked in here and it was like on the couch.
Oh my gosh.
And we're like, what the heck? But yeah, we love that. It's
Well, and it says, our little slogan in our house right from the beginning was "Teams work makes the dreams work." But because that's the other thing, Abby was commenting as well, that I just had her read it before I sent it to make sure. And she said, you didn't make it sound easy. You reminded everyone that it is work. It is work. But it's such good work.
Yeah.
So that's important to know.
Well, I thank you for not giving up, for continually pushing, both of you guys. I mean, even the other sisters, even Kevin, like, he never gave up. Like, he just kept the nose to the grindstone. You guys do what you need to do. I will pick up the pieces as I can, right?
Yeah.
And here we are, like a year later, almost to a little more than a year later.
Right.
And we're hiking. We're trying to fly, except for weather. You're looking great. It sounds like everybody's stress level is significantly reduced, and you guys are like living life.
We are.
As opposed to just scraping out of the pit of misery.
Yeah.
Well, again, thanks for the review on Google. Thank you for sharing your story, and we're happy to have you on any other time if you want to talk more about it. I would love, almost like, you know how like these shows, like Love is Blind is big right now.
yes.
So you know how they have like the whole crew gets together after the show? I would love to have like the whole family sit down. Oh my gosh, could you imagine?
Do you want to do a podcast?
Ruthie, I think
Are
it
you
would be
sure?
hilarious. And then we could get a chair for Kevin, and he would just be
Yes.
quiet the whole time. And then
She's like, I paid the bills.
yeah.
I paid the
But
bills.
I think it would be so cool to just see all of that. So if
can totally
anybody's
do
in
that.
town, just let me know. We'll just blast off for 15 minutes,
Everyone's
20
in
minutes?
town because they live with me and my college girl's coming
Yeah.
home soon. But that's what I'm
Nice.
saying. As long
Yeah.
as she gets
Well,
home.
we'll set it up and we'll look forward to hearing from you guys
That
in the
would be
future. How
fun.
about that?
Yeah.
Awesome.
I'd love to.
Well, thank you so much for sharing your story
Mm-hmm.
from a parent's point of view. And I'm just ecstatic that we're here now and
I
not
know.
where we started. So thank you so much, everybody. If you have any questions about being a caretaker in a situation like this or having a child that needs the help, just give us a call. We've got, just go check us out online, desertbrainandspine.com. We've got Desert Brain and Spine social media, I guess. It's like, what is it? Instagram, Facebook. Apparently we're on TikTok, which we're blowing up on. And find all these videos on YouTube as well as Spotify and Apple Podcasts. So thanks so much for listening, and we'll catch you next time.